Welcome to today's video about symptoms of rheumatoid arthritis. Right now, as you're watching this video, your body could be whispering warnings that you're completely missing. Imagine waking up one day with painful, swollen joints, only to discover that your body had been trying to warn you for months, maybe even years, but you didn't know what to look for. Rheumatoid arthritis is a master of disguise. It doesn't always knock loudly on your door with obvious joint pain. Sometimes it sends subtle signals that are so easy to dismiss. Fatigue you blame on stress, stiffness you attribute to aging, or symptoms you mistake for something else entirely. What if I told you that catching these early warning signs could change everything? Today, we're uncovering 12 silent symptoms that most people overlook until it's too late. Some of these will surprise you. Others might make you think twice about symptoms you've been ignoring. Stay with me through all 12, because the last few are the ones doctors say people miss most often. But before we reveal these critical warning signs, if you're new here, welcome to our community. We're building a space where health knowledge meets real people, just like you. Hit that like button if you value evidence-based health information, and subscribe so you never miss content that could genuinely impact your well-being. Here's something I'd love to know. Have you or someone you know experienced unexplained joint symptoms? Drop a comment and let us know. Your story might help someone else recognize their own symptoms. And tell us where you're watching from. We have viewers from all over the world, and we'd love to add your country to our growing community map. All right, let's dive into the list of rheumatoid arthritis symptoms, starting with number 1, fatigue and malaise. Here's something most people don't realize. Your exhaustion might not just be from a busy lifestyle. Fatigue is one of the earliest symptoms of rheumatoid arthritis, and it often appears before any joint pain or swelling becomes noticeable. This isn't the kind of tiredness that disappears after a good night's sleep. We're talking about a deep, persistent exhaustion that makes even simple daily tasks feel overwhelming. Research documented in multiple medical journals shows that this fatigue gradually increases as the body moves from arthralgia to clinical arthritis. The inflammation happening inside your body is working overtime, even when you can't see or feel it in your joints yet. Your immune system is already activated, releasing inflammatory chemicals that drain your energy reserves. Many people dismiss the symptom, attributing it to stress, poor sleep, or aging. But when fatigue persists and is accompanied by a general sense of feeling unwell, it deserves attention. Studies have shown that patients who later developed rheumatoid arthritis often reported significant fatigue months or even years before their formal diagnosis. Next, symptom 2, low-grade fevers and flu-like symptoms. Imagine feeling like you're coming down with the flu, but it never quite develops into anything major. You might experience mild, intermittent fevers that come and go without explanation. These low-grade fevers are documented in medical literature as an early sign of rheumatoid arthritis, occurring before obvious joint swelling appears. The temperature elevation is usually subtle, maybe just a degree or two above normal, making it easy to dismiss as nothing serious. You might feel generally unwell with that characteristic achy feeling that accompanies viral infections. Here's what makes this symptom so deceptive. These flu-like symptoms are incredibly nonspecific. They could be caused by countless other conditions, which is exactly why they're so often overlooked. The underlying inflammatory process that characterizes rheumatoid arthritis can trigger your body's fever response, even when the joint inflammation isn't yet clinically apparent. Your immune system is already producing inflammatory molecules that affect your body's temperature regulation. Most people simply wait for these symptoms to pass, assuming they'll recover from whatever minor illness is affecting them. Next, symptom 3, unintentional weight loss and loss of appetite. Have you noticed your clothes fitting a bit looser lately, even though you haven't changed your eating habits or exercise routine? Unintentional weight loss can be an early warning sign of rheumatoid arthritis that many people overlook. The chronic inflammation that characterizes this condition creates a hypermetabolic state in your body. Essentially, your body is burning more energy than usual to fuel the ongoing inflammatory response, even before classic joint symptoms become obvious. Research shows that patients with early rheumatoid arthritis often experience mild weight loss and decreased appetite before their joint problems become apparent. You might notice that food just doesn't appeal to you the way it used to, or that you feel full more quickly than before. This loss of appetite isn't about an eating disorder. It's your body's response to the inflammatory chemicals circulating in your system. These inflammatory molecules can affect the parts of your brain that regulate hunger. The weight loss is typically gradual and modest, which makes it easy to rationalize away. But when unexplained weight loss occurs alongside other symptoms, it becomes a more significant piece of the puzzle. Next, symptom 4 is morning stiffness and the gel phenomenon. Picture this. You wake up in the morning and your joints feel tight, almost frozen. It takes time for them to loosen up and feel normal again. This morning stiffness is a hallmark feature of rheumatoid arthritis, and it can appear even before swelling becomes noticeable. Medical literature extensively documents this symptom, noting that it typically lasts more than 30 minutes and improves with movement. The phenomenon also occurs after periods of inactivity during the day, which is why it's sometimes called the gel phenomenon. Your joints literally feel like they've turned to gel while you were resting. This happens because inflammation in the joint lining increases overnight when you're not moving. Inflammatory fluid accumulates in and around the joints, creating that stiff, rigid feeling. As you start moving and blood flow increases to the area, the stiffness gradually improves. Studies confirm that morning stiffness is one of the most reliable early indicators of inflammatory arthritis. What makes this symptom particularly important is its pattern. It affects joints on both sides of the body, typically the small joints of the hands, wrists, and feet. The duration and pattern of morning stiffness in rheumatoid arthritis is distinct from the brief stiffness that might occur with osteoarthritis or general aging. Next, symptom 5, subtle joint aches in small joints. Before the obvious swelling and redness of rheumatoid arthritis appears, many people experience something more subtle, mild, transient joint pain or tenderness known as arthralgia. This symptom is extensively documented in medical research as a precursor to full-blown arthritis. The pain typically affects the small joints, fingers, wrists, and toes. And here's the telltale sign. It tends to be symmetric, meaning the same joints on both sides of your body are affected. You might notice a dull ache in your knuckles or wrists that comes and goes. The pain might be mild enough that you can continue your daily activities, but it's there, nagging at you. Research emphasizes that this arthralgia phase can occur before any visible swelling develops. Your joints might feel tender to the touch, even though they look completely normal. What makes this symptom so easy to miss is its subtleness and intermittent nature. Many people attribute these aches to overuse or just general wear and tear. But when joint pain is symmetric and involves multiple small joints, it represents an important early warning sign. The synovium, which is the lining of your joints, is already becoming inflamed. Next, symptom 6, burning sensation and subtle warmth around joints. Some people describe an unusual burning sensation in their joints before any swelling becomes visible. This symptom might be accompanied by subtle warmth or mild redness around the affected areas. Medical research has documented these sensations as early indicators of inflammatory changes happening beneath the surface. The burning feeling is distinct from typical pain. It's more of an uncomfortable heat or tingling sensation that seems to emanate from deep within the joint. You might notice that certain joints feel warmer to the touch than others, even though there's no obvious swelling or redness visible. These sensations reflect very early or subclinical inflammation occurring in the joint lining. Even before enough fluid accumulates to cause visible swelling, the inflammatory process has already begun. blood flow to the area increases, inflammatory cells migrate to the joint space, and chemical mediators are released. All of this can create that characteristic burning or warm sensation. Studies confirm that patients at risk for developing rheumatoid arthritis do report these burning and warmth sensations before overt disease manifestation. Your nervous system is detecting the inflammatory changes and signaling that something is wrong. Next, symptom 7, subclinical inflammation on imaging. Here's something truly fascinating. Your body might show evidence of rheumatoid arthritis on imaging studies even before you have obvious symptoms. Advanced imaging techniques like MRI and ultrasound can detect synovitis, inflammation of the joint lining, and bone marrow edema before clinical arthritis becomes evident. Multiple studies have demonstrated that these infraclinical joint changes can predict progression to full rheumatoid arthritis. This means the disease process is already underway at a microscopic level, even though you and your doctor might not be able to see or feel it during a physical examination. On MRI scans, radiologists can visualize fluid accumulation, tissue inflammation, and early bone changes that indicate active disease. Ultrasound imaging can detect increased blood flow to inflamed joints and subtle thickening of the synovial lining. Research has shown that people with these subclinical imaging findings are at significantly higher risk of developing clinical rheumatoid arthritis within months to years. The challenge is that most people don't get MRI or ultrasound imaging of their joints unless they already have obvious symptoms. But for individuals with risk factors, these imaging techniques can provide crucial information and help identify who might benefit from early intervention. Next, symptom 8, elevated inflammatory markers without obvious symptoms. Your blood might be revealing secrets about your health that you're completely unaware of. C-reactive protein and erythrocyte sedimentation rate, commonly called CRP and ESR, are markers of inflammation that can be measured with simple blood tests. Research has documented that these inflammatory markers may be modestly elevated years before rheumatoid arthritis symptoms become obvious. These elevations often occur alongside the presence of autoantibodies, creating a biochemical signature of impending disease. The elevation might be subtle, not dramatically high, but persistently above the normal range. Because there are no overt symptoms accompanying these laboratory findings, they may not trigger medical attention. You might have routine blood work done for another reason, and your doctor might note that your CRP or ESR is slightly elevated. But when these inflammatory markers remain persistently elevated, they indicate that chronic inflammation is occurring somewhere in your body. In people who later develop rheumatoid arthritis, these biomarkers are often elevated in the preclinical phase of disease. Your immune system is already activated, producing inflammatory molecules that elevate these blood markers. Studies emphasize that the combination of elevated inflammatory markers plus the presence of specific autoantibodies significantly increases the risk of developing clinical rheumatoid arthritis. Next, symptom 9. Autoantibodies appearing before clinical disease. Imagine if your body started producing warning signals years before you felt sick. That's exactly what happens with rheumatoid arthritis. Anti-citrullonated protein antibodies, commonly known as ACPAs or anti-CCP antibodies, along with rheumatoid factor, can be detected in the blood years before symptomatic rheumatoid arthritis develops. This finding has been extensively documented in medical research and represents one of the most significant advances in understanding how this disease evolves. These autoantibodies are proteins your immune system produces that mistakenly target your own tissues. Their presence indicates that the autoimmune process underlying rheumatoid arthritis has already begun, even though you feel perfectly fine. Studies show that people who test positive for these antibodies have a significantly increased risk of developing clinical rheumatoid arthritis in the future. The risk is especially high when multiple autoantibodies are present together or when autoantibodies are combined with elevated inflammatory markers. What makes this so remarkable is the long preclinical period. The time between when antibodies first appear and when symptoms develop can span many years. Research has focused intensely on this preclinical phase because it represents a potential opportunity for intervention. The combination of autoantibodies plus low inflammation increases the risk of future rheumatoid arthritis. Next, symptom 10. Mild hematologic changes. Your blood count results might contain subtle clues about developing rheumatoid arthritis. Even before joint symptoms dominate the clinical picture, early rheumatoid arthritis may cause mild anemia, specifically the normocytic anemia associated with chronic disease. This type of anemia is characterized by low iron availability because inflammation affects how your body utilizes iron. Research documents that this anemia can appear quite early in the disease process. You might feel more fatigued than usual, look a bit pale, or feel short of breath with exertion. In some cases, people with early rheumatoid arthritis show mild reductions in white blood cell counts, known as leukopenia, or in platelet counts called thrombocytopenia. These cytopenias are typically mild and might not cause any symptoms at all. They're often discovered incidentally when blood work is done for another reason. The chronic inflammation that characterizes rheumatoid arthritis can affect bone marrow function and blood cell production. These hematologic changes are subtle enough that they might be overlooked or attributed to other factors. But in the context of other early rheumatoid arthritis symptoms, these blood count changes become more significant. They provide additional evidence that a systemic inflammatory process is underway. Next, symptom 11, extra-articular organ involvement. Here's something that surprises many people. Rheumatoid arthritis isn't just a joint disease. Even in its early stages, this condition can affect other organs and systems in subtle ways. Research has documented various extra-articular manifestations that might appear before joint symptoms become prominent. Your eyes might feel persistently dry and irritated, a condition known as keratoconjunctivitis sicca, which can occur as part of associated Sjogren's features. Your lungs might show mild interstitial changes or subclinical involvement on imaging studies, minor fibrosis or pleural thickening that doesn't yet cause respiratory symptoms. Medical literature documents that lung involvement in rheumatoid arthritis can occur earlier than previously recognized. Your skin might develop firm subcutaneous lumps called rheumatoid nodules, typically in pressure areas like the elbows or fingers. These nodules can sometimes appear before joint swelling is prominent. In rare cases, very mild vasculitic changes affecting small blood vessels might occur, potentially causing small infarcts in the fingertips or areas of reduced blood flow. These extra-articular manifestations reflect the systemic nature of rheumatoid arthritis. The inflammatory and autoimmune processes don't confine themselves to joints. They can affect connective tissue, blood vessels, and organs throughout the body. Studies emphasize the importance of recognizing these manifestations as they can provide early clues to diagnosis and may influence treatment decisions. Next, symptom 12, neurologic symptoms. Your nervous system might be affected by rheumatoid arthritis before your joints show obvious problems. Subtle peripheral nerve involvement can manifest as sensory symptoms, tingling, numbness, or altered sensation in your hands or feet. This can occur even when inflammatory swelling is still mild or subclinical. Medical research has documented that compression syndromes, particularly carpal tunnel syndrome, may develop before overt hand swelling becomes apparent. You might wake up at night with numbness and tingling in your fingers, or notice that your hands feel clumsy or weak. These symptoms occur because inflammation and swelling in the wrist area compress the median nerve as it passes through the carpal tunnel. What makes this particularly interesting is the timing. The compression can develop from subtle inflammatory changes before the joint swelling is obvious to you or your doctor. Studies show that people with rheumatoid arthritis have an increased incidence of carpal tunnel syndrome and other nerve compression issues. Some people experience a mild sensory neuropathy, where the small nerves in the extremities don't function quite normally. This might manifest as odd sensations, decreased ability to feel light touch, or altered temperature sensation. These neurologic symptoms can be frustratingly vague and difficult to describe. You might struggle to explain exactly what you're feeling, which can make it challenging to communicate with healthcare providers. But peripheral nerve symptoms in the context of other early rheumatoid arthritis signs deserve attention. They indicate that inflammation is affecting structures beyond the joints themselves. Recognizing these subtle neurologic manifestations can contribute to earlier diagnosis and treatment, potentially preventing progression to more severe nerve damage. These 12 silent symptoms of rheumatoid arthritis remind us that our bodies often communicate in whispers before they scream. Fatigue, subtle fevers, unexplained weight loss, morning stiffness, mild joint aches, burning sensations, imaging findings, elevated lab markers, autoantibodies, blood count changes, organ involvement, and neurologic symptoms each represents an early warning sign that deserves attention. If you're experiencing several of these symptoms, especially if they're persistent or progressive, it's worth discussing them with your healthcare provider. Early detection and intervention can make a difference in outcomes. If this video provided valuable information, kindly type "helpful" in the comments. That really motivates us to create more evidence-based content like this. Please give this video a like if you found it informative, share it with anyone who might benefit from this knowledge, and subscribe to our channel for more health content backed by medical research. Thank you for watching, and remember, listening to your body's subtle signals might be the most important thing you do for your health.